The goal is to tackle a symptom. It's a long-term symptom we call chemo fog. That's a result of the treatment and the cancer, and it just lingers. And it's a lasting symptom if it's not addressed and can lead to other issues. And we're looking specifically to see what are the right ones, what are the good bacteria that actually help support our digestion. They're responsible for brain function, supporting our immune systems. So it's a lot that's happening in our guts that we're not even aware of. Hormone changes also, especially those who've undergone cancer treatment or chemotherapy, a lot of the taste receptors go away.
Welcome back to Stick a Fork in It. So excited to chat with you again and to learn new things. And, one thing that we've at Feeding Tampa Bay that we've learned is food is medicine. And we've been talking about this for years. We've been talking about it out in the community, and it's really taking hold, and I believe it's becoming a movement. We had Lisa Bell on with Bay Care talking about all the things that we've done in the community, addressing health, stepping in and being proactive, making sure people have the health that they need. And there's so many other organizations, healthcare facilities that are all diving into this on how we can stay healthy before we get sick, but also if we are sick, what is the best way for us to take care of ourselves? So I'm really excited to have Chef Jules join us on Stick a Fork in It. And today we're sticking a fork in healthy eating, whether you're well, struggling, or what have you. So tell me, Jules, a little bit about where you work.
Sure. So thank you so much for having me here, first of all. Very honored and love that we're getting to have this dialogue. So I work for Moffitt Cancer Center as a research chef, and I had no idea what a research chef was before I started there. It really is a unicorn of a role, and so happy to have found my way to Moffitt. It's a role that needs to be more prominent, and hopefully in the future, this is something you see more commonly. But basically, I work at a facility called Pearl. That's part of Moffitt. It stands for Population Engagement and Research Lab. Pearl, much easier to say.
Yes.
But what we do there, we're conducting all kinds of oncology studies, and it's a really holistic approach. We have studies that tackle smoking cessation, exercise, and diet interventions, all with the goal of cancer prevention or interception. Okay. So we're addressing the cancer continuum, whether, like you said, whether we are just focusing on preventing, whether you're going through treatment, and if you've made it through to the other side and survivorship, we address the entire timeline. And so I'm very lucky to be a part of the diet studies, and what my role looks like there from day to day is creating menus that support different health goals depending on the goal of the study. And I create menus and measure down to the macronutrients these menus and ingredients so that the food is interesting and exciting, while also being
pretty.
Healthy. Exactly, because that's just
like
as
what
important.
We all want.
Yeah, we eat with our eyes first. But I create these menus, and then we prepare and cook the meals on site. We have an amazing research kitchen, and we prepare the meals for our participants that have signed up for the studies, breakfast, lunch, dinner, snacks, for the entire duration of the study.
And how long is the study typically?
So it depends on the study, but the one that I am assigned to currently is called Mind. It's a Mediterranean diet mostly, but kind of blended with DASH as well, which is a low sodium diet.
Okay.
And so it's a 12-week study. And we're doing constant groups, usually about 15 to 20 participants for 12 weeks at a time.
Okay.
And we have excellent research coordinators that are able to in-house take all kinds of lab work, blood work, measure all of the things they need to see the results in real time, and at the end of the study to see what the outcome of the diet was.
So we'll get to that. We're doing something similar that we are in partnership with Bay Care.
Amazing.
But how did you choose culinary? Like, what's your journey to getting to Moffitt and being a research chef?
Sure. It's been a long one. It's been a zigzaggy, winding road. It wasn't a direct path, and I didn't start out in the culinary world at all. My husband was really the one to kind of inspire me and kind of turn on that light bulb and make it click that I love food and I've always loved cooking. It's been a prominent part of my life. And it's just kind of crazy that looking back, it was never obvious to me that I should do that for a living since I love it so much. But it came to be when we were kind of going through boxes we had in storage, and he found a box of my diaries, which was like a treasure chest for him, but had like way too much fun. I kept a journal like religiously as a little girl, and and you know the embarrassing stories were like gold for him, but he kept finding this common theme that I wrote in detail about every dinner almost every day. I had notes about things that I ate out if my family, like if we were out for the day, what I was excited to eat about at lunch in the cafeteria the next day. Like it was all so food focused. And I had this aha moment of like, yeah, I had a play kitchen like really young. My toy cash register was used to like run a restaurant out of my bedroom. Like it was always
And it
just
took your
something-
husband digging through your old notes to be like, you know what you should do. What were you doing before you made that decision?
So I was working in offices and corporate as an administrative assistant.
Okay.
I kind of early on, right out of high school, I had a necessity to make money and kind of support myself. So that took priority over, you know, I didn't really have the focus of like, okay, what do I want to do with my future? Because it was really just the day-to-day making ends meet. And so I was able to get a scholarship for my associates and was always interested in science too growing up. I loved science fiction books and movies, documentaries about space always fascinated me. So I did that. And, you know, as much as I loved the learning, I was like, I don't see myself in a lab. And so I never saw a path for myself until that moment with my husband going through my diaries as a kid on our floor. But it's amazing how it was kind of always there. It just had to become clear to me that, you know, I've cooked for my family. I cooked for my family dinner growing up. Friends and family I always had over to entertain. I loved hosting dinner parties. And it was just this underlying thing of I love nurturing people and through food.
Yes.
And bringing people together at a table.
Yeah. I was going to say so many great things happen around the table. That's where so many core memories are created.
Yeah, definitely.
We here at Feeding Tampa Bay, we are the food bank. We make sure everybody gets food, but we've also moved into the health and hunger space, and which I think it's important. Like I said earlier, it's kind of a movement for healthcare and people who care about that to make sure that we create opportunity for folks, especially those that are food insecure, to be able to have access to those medically tailored meals. So we went through all the different steps and stages, which is as it should be. Right. It's
a process.
It's a process, and it's a long one. And still, it's a process when you create the meals, right? So if you change any little thing, but here we have Chef Doreen, and she is amazing. And she found it's like much like we need to have her on the podcast because much like you, it's like she found what she loved and ended up coming here. And she's always loved to cook, and the color has to be right. You know, cooking is a science. It's an art. It's a science, counting everything, using other ingredients so you don't miss the salt or you don't miss the carbs or you don't, because all of that can be created and it can be beautiful. So when you say medically tailored, gosh, it sounds like, I don't know, like a white tray with the,
there's a stigma to food and healthcare.
But that is nothing like it is now.
Right.
It's so thought out. What is the process? So we know the process internally, and then we partner with Baycare, and we package these meals. We're running a pilot program, 40 people, heart disease and diabetes.
Wow.
So there's couple different paths. We've come up with, I believe it's 50 recipes.
Wow, yeah.
They're flash frozen. All you do is take them out and put them on the counter. You need a few hours for them, and then you just nuke it a little bit. So all those things keep the flavor.
Yes.
But it's also, to me, for someone who's struggling and going through something, right? To cook that way is very expensive. Like, you look at all the ingredients, to keep it gluten free or what have you, like all those grains and things like that are more expensive. So you're cooking these wonderful meals, preparing these wonderful meals for folks that would never be able to eat at that level, which is really sad to me,
Right.
that we couldn't do it ourselves, but they have people to depend on, like what you guys are doing at Pearl, what we're doing on a much smaller scale here. So tell me, so you guys are addressing a number of different goals, different plans,
Different
platforms.
studies. Yep.
What is the one that you're intrigued with the most, and what has the outcome? Because we're all looking for outcomes, right? And they want to feel better. And
Right.
what is that? What has intrigued you, and what has been the most positive outcome that has come out from your efforts in the lab?
Sure. So, like you said, like you mentioned, these are medically tailored. There is no one diet fits all.
Right.
And I love that you're doing this work and we're doing this work at Moffitt, because there is so much information to sift through in terms of what's healthy. And fad diets change so quickly, and people cling to them, and it's not always what works for you. And,
Right.
We really have to take a step back and take the approach of, okay, what are my personal health goals? What am I looking to get out of this? And how can I support that with food? And so my favorite study is the one I'm actually assigned to. No bias.
You're right.
But the MIND study is very remarkable. We are focusing on breast cancer survivors. And the goal is to tackle a symptom. It's a long-term symptom we call chemo fog.
Yes.
It's a brain fog. It's a lack of clarity and like a decreased brain function. That's a result of the treatment and the cancer. And it just lingers, and it's a lasting symptom if it's not addressed, and can lead to other issues. And so the diet is designed to be anti-inflammatory, and also it focuses on high fiber. We are measuring and we're closely studying our gut health and our microbiome. We all have good and bad bacteria in our gut, and we're looking specifically to see what are the right ones, what are the good bacteria that actually help support our digestion. They're responsible for brain function, supporting our immune systems. So it's a lot that's happening in our guts that we're not even aware of. Hormone changes also. And so a high fiber diet actually encourages the right gut bacteria, we're finding. And so I love the approach. It's very vibrant food. It's a lot of fruits and vegetables, dark leafy greens, lean proteins, lots of beans and legumes, nuts. So things that are actually can be accessible and very affordable. One thing we keep in mind as well when we're designing these menus is it's got to be approachable. We want our participants to have a good experience and be able to eat the food. Otherwise, we can't see the results properly. But also, we want them to continue the diet and take this into their lifestyle moving forward. If it's something sustainable that they actually enjoy, and we source all of our ingredients in a way that there's nothing pretentious, there's nothing super expensive or fancy about it. They're repeatable recipes. And so all of our ingredients can actually be found at a local supermarket, and regardless of where you shop. And we try to incorporate a lot of beans. Like I said, it's a daily requirement of the diet, but great way to get a ton of fiber and protein for a very little dollar amount.
Okay. All right. So give us an example of what a meal would be.
Sure. So we have a creamy white bean soup on one of the weeks. We do like a 4-week rotation with the menu.
Okay.
But one of the weeks has a creamy white bean soup where we're naturally thickening the soup by blending cannellini beans or Great Northern beans. And we add nutritional yeast in lieu of cheese. The MIND diet specifically, I don't get to have fun with salt or with cheese as much or full fat dairy. So there's some restrictions, but we find our ways to navigate those challenges.
The alternatives that make it work.
Nutritional yeast is great for adding that umami, which is that kind of fifth taste flavor that we get from cheese and really rich foods. And we add a ton of vegetables to it as well. So there's your mirepoix, we have onions, celery, carrots, also fennel, which is great for digestion, and a ton of herbs. I love, love, love herbs. They do more than we give them credit for. They're packed with polyphenols and so antioxidants that help fight inflammation. They're very reasonable and affordable. They last in your fridge forever if you take care of them or freeze them. And they add not just color and freshness and taste and vibrancy, they also kind of engage the olfactory sense. And so that's important too, because most of what we perceive as taste is our olfactory and what we're smelling. So these are just a few of the tricks that we incorporate to battle the restrictions of the diet.
Right. And it's so funny you say that, because it's, when you're a kid, before you try something new, you smell it.
Yeah.
Always, right? You always
It's like instinctual because, at a base level, it keeps us away from things that could poison us or spoiled food. But it's very important for how we perceive taste. And especially those who've undergone cancer treatment or chemotherapy, a lot of the taste receptors go away or they're damaged. And so we have to really make sure we are punching up the flavor. Herbs is a big one, like I mentioned, but also citrus and acid. Because we're limiting the sodium intake, citrus and acid, like vinegars, kind of get the salivary glands working. And so there's a better mouthfeel. You're going to perceive more flavor because things are kind of already starting to break down and happen in your mouth. And also you're getting polyphenols from those again. The zest in citrus is just so incredibly fragrant. So it's tackling it from a multi-sensory approach, and also not seeing the low salt or the lack of cheese as a restriction, but just there's workarounds.
Right. It's fascinating to me that so much thought, again, science, care that are put into these meals, and they're for medical reasons. But, it also could be just for anybody, right? To eat that way, right? To help you with your clarity and
Absolutely.
your gut health and all the things.
Can all use more clarity, I think.
Girl. Don't ask anybody around here. It's like, I told you that 5 minutes ago. I forgot,
Yeah, exactly.
It's like, I want you to leave a recipe book back for me.
So I actually, I can be guilty of it too. And because of convenience plays such a big part in our lives, we're all so busy that it's easy to lean into takeout and fast food. And so, paying attention to these menus and these studies has really helped me to adjust at home as well too. And remember hey, it's okay to eat certain things. If I'm going to eat that bowl of pasta, let me just throw some kale in it. Let me throw some white beans in there with it so that we're actually adding nutrition to our fun foods too.
What about the protein pasta?
Oh, I love the protein pasta.
I've actually acclimated myself. That's all we eat now.
Yeah.
At first, when you eat it, it's like, okay.
I recommend if you're going to try it, don't go with the long pasta. Go with the short, like a rotini or a penne to start, because I think the texture can be a little different when you get to the longer, like a spaghetti or a linguine. My husband's Italian, so unfortunately, that's been a losing game.
He has to have his regular pasta.
Yes.
You're making 2 things of pasta for
Hence
dinner.
me adding the kale and lean ground turkey or trying to make it healthy in some way for him. But I love the protein pasta. I think that's a great sneaky way to just get that in there, especially for kids. Yeah.
Yeah. How do you feel, how does your husband feel, kind of helping you find your way? And then now where you are now, he must be...
He loves it. He really loves that I love what I'm doing. I really have found my dream job, and he is my biggest fan and supporter. And, I'm lucky that I found my best friend really, really early in life. And we both support and uplift each other. But, I've helped him realize goals of his, and he's done the same for me. Right. And I'm so glad that my path has led me here, because it's such rewarding work. I did have a background in catering when I got done with culinary school. And as much as I enjoyed that, there is a different purpose you feel when you're feeding someone for fun and their convenience because they didn't want to cook versus you're having a positive impact on somebody's life and trying to nurture their soul and not only their bodies but their soul and their spirit to get them through a really difficult time. And that's what I love about food. Food is hope.
It is, and it's you think about someone quite often. I think people think about someone who's battling cancer and then they've survived it. Obviously it's a big deal, but it's just not over yet.
Yeah,
right? So you have all of those lingering challenges that each patient, and it's all different because we're all built different, and it's taking care of that and recognizing it. I would imagine people, it makes them feel better. We all need somebody to have somebody care about you. I'm just envisioning someone who's alone that has gone through this and gets into this program with you, and you guys are working with them and teaching them and talking to them after they've been through like the worst thing in their lives is very uplifting. And tasty, but it's always twofold, right? It's more than a meal. It's more than just being around the table. It's having somebody care and pay attention to you. I really love that you guys have that, and I love that we're doing it here. We're just in the beginning.
Too. More people need to be doing this. I think we're one of, it's like less than 10 facilities that we know of in the nation that are doing the kind of oncology research that we're doing at Pearl and the food programs as well, like you're supporting as well. Yeah. And so this is something that needs to catch on. It's a common sense thing. We are what we eat. We know eating healthy can affect our overall health. So why not put the supporting numbers and the data to factually say this is medically necessary?
Yes. Because it really is, and we know the changes. We've already got, some of the data that it's just people are feeling better, doing better.
And we're just starting out, so unfortunately I can't share any outcomes with you today. But in the near future,
we'll have to have you come back.
Definitely, please. It's just been in the past year that the Pearl Kitchen got up and running, and in that past year we've already grown. We're hoping to expand our kitchen. Because we've reached capacity actually with storage already. We have several studies that we're supporting and more to open on the way very soon.
Wow. So all these people are going to be positively affected. So we're almost wrapping up here. So I want to get to know you a little bit better.
Sure.
There's some basic questions. I'm going to change them up a little bit. I know you got a little notes. But it's because of the things that you mentioned. So what is your favorite herb to cook with? What do you think is the most flavorful, general? I'm a basil girl. I could put basil on anything.
Basil is great. It is one of those like super fragrant ones.
Yes.
I love rosemary. I'm a sucker for rosemary. And it can be so overpowering, so you have to be careful with it. And you use different quantities depending if you're using dried or fresh.
Right.
But I just love it. Instantly reminds me of like a roast chicken. And like, I love the smell of rosemary around my house. It's just like very comforting to me. So I love incorporating that whenever I can.
Okay. So you do what you do now and you love it. What would be your hope? Let's take it 5 years from now.
Okay.
On how lives are impacted by your work and your team's work.
Where we have very, very intentional goals for our future, and we have a lot of potential to grow into. And 5 years ahead, oh my gosh, who knows where we could be? But my hope is that we have the data, like I said, we have the outcomes from the diet studies, and we can definitively say this is the best tailored diet for this health goal or this part of treatment, or if you're priming yourself for surgery. And like I said, it can become something that is deemed medically necessary. And who knows, maybe this is something where insurance can come into play and help with the food accessibility and have it be a guarantee for patients and give them that much more of a fighting edge and chance. Yeah.
Well, it's interesting because before we started recording, I was telling you how I saw a bunch of folks in Moffitt, Mr. Moffitt himself.
Yeah, yeah.
It was like Elvis walked in the building.
He
it was so
is
wonderful.
a rock star.
He is so wonderful.
He is. He's the sweetest.
He really is, and he got so emotional because he was talking about all these new things, and it really, we were all up there speaking with elected officials on how important food is medicine, and it should be part of our healthcare system.
Definitely.
And keeping people out of the hospital.
Right.
So I really want to thank you for taking the time to come over and chat with us. I want to have you back. You have to keep in touch with me and let me know when you have some data, because I know
Definitely.
it's going to be very exciting. And thank you so much for joining us,
Thank you so much for
Jules.
having me. I appreciate, the engagement and having these discussions. So
Thank you for being in it with us. We just love it. So you guys know that food is medicine. There are food banks and healthcare facilities that we're all out there really in the weeds trying to figure out how we can make this something that's affordable and available to everyone. So watch what you eat, man. See you next time.